Hi, I'm Dr. Samir. I'm a board certified cosmetic and plastic surgeon. I do practice in Mumbai and Goa, and I'm the director of Evol Cosmetic Clinic and SA Aesthetics. In today's video, I'm going to give you some details regarding breast fat transfer. How is the procedure done? What all things you need to consider if you're looking to get your augmentation done through a breast fat transfer? Then this video will clear all your doubts. So let's start with today's video. Not many people know that there is an option for breast augmentation which is not silicone, which is not saline implants, but transferring fat which is harvested from yourself into their own body. So this is a newer method. In last 10-15 years people have started doing breast fat transfer for breast augmentation. What is breast fat transfer? So basically what we do in breast fat transfer is we do harvest your fat from unwanted areas, and then we will inject or transfer this fat into your breast, or we might inject sometimes into your buttocks, sometimes in your face also. When it is done to augment your breast, we call it as breast augmentation with breast fat transfer. The advantage of this procedure is it gives you a dual advantage of body contouring of some area, for example your abdomen, flanks, inner thighs, or love handles or arms, and plus to that also augmenting your breast. Implants are definitely a very good, reliable, safer option for breast augmentation, but breast fat transfer is also safe and it can also be an alternative. So it depends what are your goals, what is your expectation. If you are having realistic expectation, then definitely breast fat transfer can be an option for you. How is it performed? Usually we do harvest 1 to 2 liters of fat from your unwanted areas like your abdomen, inner thighs, flanks, love handles, arms, or maybe chin. Then we do centrifuge or process this fat. We convert this fat into micro fat or nano fat, and then we inject it into your breast. The most important factor you need to consider, and which comes with the knowledge of your surgeon and the skill of your surgeon, is how evenly he is able to distribute the fat, whether he is able to place tiny fat particles or globules in different planes, also whether he is able to correct the asymmetry, whether he can do a good amount of diffuse distribution without actually traumatizing the fat. Here I like to tell you, I don't use a laser liposuction when I do transfer fat, because of the heat produced from laser, sometimes your fat cells might get traumatized and hence your results might be affected because of the laser liposuction. Hence I do a normal liposuction, or maybe I'll do a USG guided liposuction or a laser liposuction to increase your survival. After this is done, you need to be careful. You don't pressurize that area. You don't give tight dressings in this area. So this is how breast fat transfer is performed. So who are the good candidates for breast fat transfer? Usually who are having minimal sagging of their breast, patients who have good skin cover, and they need very limited amount of fat or augmentation. These are usually the ideal candidates for breast fat transfer. Plus to that, if you are looking for fat transfer, it is usually done in generalized way to increase the projection, but then we can go only half or 1 cup size up. Second thing, if you are having any kind of localized asymmetry or localized you want a projection, then definitely you can go for breast fat transfer. For example, if you are having breast in the lower area but you don't have in the upper pole, then for upper pole fullness you can go for breast fat transfer. Plus to that, you can inject some amount of fat under your nipple or areola in case of patients who are having thin skin cover after implant surgery. Also after implant surgery, if you want to give more shape, more contour, then definitely less palpability, you can go for breast fat transfer. So to summarize this, who are the candidates? First of all, you should have good fat. Second thing, you should must had weight gain, weight loss, pregnancy, breastfeeding, so that you have adequate skin cover. So these are the basic criteria for candidate to be a who can go ahead with the breast fat transfer. What results to expect? Definitely, when we'll do augmentation with breast fat transfer, you are going to go half or 1 cup size up. So definitely, if you're looking for a little bit of fullness, little bit of projection, more shape, then breast fat transfer is a good option for you. Result wise, definitely fat has a mind of its own. So if you're going to gain weight, lose weight, or you're going to keep on changing your lifestyle, then definitely it will affect your breast component also. So what we do advocate is you should be around your ideal weight, or little bit maybe 2 to 5% around your ideal weight, so that you can go ahead with breast fat transfer. Why it has increased in last 10 to 15 years is because of the safety, because it is a kind of a natural process in which we do transfer your own fat into your breast. Third thing is people do have fear about the implants, in that sense that they don't want a foreign body to be inserted in their body. So if you are looking for something very nominal augmentation, for example, moms who after pregnancy, after childbirth, after breastfeeding have some changes in their body, and they don't want an implant, they don't want a major difference in the breast, they want little bit projection, little bit fullness, then these people are definitely go ahead with breast fat transfer, and that is the reason that trend has increased in last 10 to 15 years. So next, you must be thinking what are the risks, what are the complications involved with this procedure. So let me just enlist a few. For example, when we do liposuction, you might have bleeding, you might have infection, you might have pain. So these are the things which are related to the liposuction, like there can be counter irregularities, or there can be new fat deposition. So all these things can be related to the liposuction part. Regarding the fat transfer part, maybe low satisfaction rate. One issue which is noticed with breast fat is there is good amount of reabsorption. At least 30 to 40% of the fat is reabsorbed. So usually we overdo the transfer, so that after reabsorption also you can achieve what has been explained to you or what you need. Plus to that, there are certain other things like micro calcification happens, so that there can be lumps which can be palpated in your breast. There can be sometimes oil cyst in your breast. If we, rather than putting fine globules, if we concentrate on putting more amount of fat in one particular area rather than changing the planes. So these all complications are related to your surgeon skills, and definitely if your surgeon is well experienced in this procedure, you can expect your risk and complications to be nothing or minimal. So the next thing is you need to know is whether this can interfere with breastfeeding. So definitely we have done a study in which whichever patients have done breast fat transfer or breast implant with us, we have seen like after the procedure they have conceived, whether they are able to breastfeed, and we have found they are having absolutely no issues in breastfeeding or any other thing which is related to pregnancy. So definitely breast fat transfer is a very safe from that point of view. There is no interference in your pregnancy or breastfeeding. So what happens to your breast after exercises? As I told you, fat usually has a memory, and because of this memory, if you're going to exercise, if you're going to lose weight, or if you're going to gain weight, then definitely there is going to be a change in your fat component also. So from that point of view, as I told you already, you have to maintain a stable weight, and we don't expect you to have any kind of changes for next 10 years. So if you're going to maintain a stable weight, there won't be any fat regrowth or loss for next 10 years if you follow a normal lifestyle. Does breast fat transfer interfere with your mammography or breast cancer screening? So in 1987, there were some reports in which it suggested it did compromise with the mammogram or breast cancer screening. But to tell you the fact now is they have refuted this theory, and whatever is mentioned is just the theoretical, but practically we have not found anything like if breast fat transfer is interfering with mammography or it is interfering with breast cancer screening. Also, because of breast fat transfer, we don't expect you to have increased chances of getting a breast cancer. So definitely it's a safe surgery. And if you ask me, like any of my family members want to go ahead with this surgery, I'll definitely say them you can go ahead because it's a safe process. Recovery wise, we tell you 1 week of solid rest and 2 to 3 weeks of gradual recovery period is what is advocated. After 3 weeks, you are able to do all exertional activities, exercises, swimming, what you are able to do before the procedure. The next question is, can implants be combined with breast fat transfer? Yes, definitely. We do fat transfer with implants when we have to increase the thickness of the skin. We do put it under your nipple areola where we want to decrease the palpability of the implant. We do fat transfer when we want you to give a good cleavage, we want to increase your cleavage. So, and the last thing is if you want to give you a lateral shape also. Usually implant will give you all these things, but still you want more enhanced without increasing the volume, then fat transfer can be an option for you. Cost wise, if you ask me, breast fat transfer is more costly as compared to implants, because implants definitely, implant has its own cost, but then procedure wise, fat transfer will take at least 2 to 3 hours for the procedure. Implant we do finish in 1.5 hours. You need more recovery in fat transfer as compared to implants. You need more medications, more things associated in fat transfer as compared to implants. So usually, definitely the cost what we charge is more for breast fat transfer as compared to breast implant surgery. So what is more advantageous, or what is the basic difference between implants and fat transfer is, with implant we can give you a cleavage. With implant we can give you any size what you want. We can go 2, 3, 4 cup size. With implants we can definitely give you a more rounder look, more shape as compared to fat transfer. And last is, in transgenders, with implants we can change your inframammary fold status also, which we can't do with a fat transfer. So this is the direct advantageous things of implants over a fat transfer. So finally, to summarize, yes, breast fat transfer is a safe, very natural procedure. You might need to repeat it 1 or 2 times to achieve the desired result, and you can go only half to 1 cup size up as compared to implants. So these are all the things which you should know if you are thinking of getting a breast fat transfer. So if you are also having any questions, if you are having any queries, you can put it in the comment box. My team will get in touch with you and they will help you out. Thank you.